So hey guys, today we are going to discuss another topic that is related to the medical lectures, and today we'll be discussing about systemic lupus erythematosus. Okay, what is systemic lupus erythematosus? Systemic lupus erythematosus is a type of autoimmune disorder. Okay, this autoimmune disorder is very mysterious type of autoimmune disorder with wide branches of symptoms that seems to be unrelating to each other, and usually it is an headache for most of the rheumatologists and most of the medical professionals, right, to diagnose it. The reason being for this disease to be complicated is due to its behavior in the immune environment. Okay, in immune environment, the antibodies which are made by this condition is very different from other illnesses, right? Like in case of HIV infection, we know a retroviral load is made as an antigenic response in the cellular compartments, immune compartments, right? But in the case of systemic lupus erythematosus, you'll always be having a nuclear antibody, anti-nuclear antibodies, right? These anti-nuclear antibodies are responsible for altering the DNA structure and the cell cycles. Usual working of DNA structure, cell cycle, the mechanism, the biochemistry of the cells, the metabolic activity and the cycles that happens in the body. Apart from that, the normal cytopathology of the cells in the immune environment, right? So it tends to alter the mechanism because the anti-nuclear antibodies that are made due to the response of the immune cells that has generated autoimmunity, like, so you have read about the major histocompatibility index. This major histocompatibility index is just a marker of understanding how a certain set of DNA and genomic DNA, a particular cell or a group of cell in an individual body has the data information in that is being stored in such a manner. That same encryption, when is applied or subjected to another human being with another type of DNA structure, wiring, and you can say encryption, got mixed up. So, due to the mixing of the different encryption of the DNA codings, in terms of, you can say in a layman sense, the codons, the way the codons are arranged and the silencing, and you can say mishappening in the uh, DNA cycle, DNA mechanism cycle, or you can say missing of some proteins formation, missing of some exonic proteins, some other types of proteins that are very much responsible for the biochemical activities, cytopathological activities, or mechanistic activities, they get altered, and due to that different type of cells produce different type of cellular response to the environment. So these anti-nuclear antibodies, they produce a different type of antigenic response that in terms helps the antigen presenting cells to generate more and more neutrophils. Due to generation of more and more neutrophils, the immune environment cells and the body's cells like B cells, T cells, helper cell, okay, and killer cells, natural killer cells, these and the beta cells, these gets activated partially due to alterated cycle of immune response due to mismatch of the MHC, mismatch of the like antigenic characteristic. This could be like a mismatch of the blood, you can say RH factor, the blood group of two different individuals, or any, you can say congenital abnormality in the sperms, or you can say a genetic defect in an individual. So when it combines in a fetus or in a chromosomes that is of budding phase, this characteristic gets to get along with that. So usually, why this disease and the condition got mysterious, because due to the aberration of the chromosomes at the certain age of the growth of individual gets altered out due to non-antigenic response, or you can say altered response, okay, of the immune system. So usually, how we categorize it as a disease according to the ICD-10 guidelines, when an individual may be male or female of any ethnicity, maybe Caucasian ethnicity, Indian ethnicity, or Mexican ethnicity, or purely American ethnicity, or European ethnicity, is has been born with this condition. Usually, at the age of 9, they develop a Mallory rash. Suppose this is the cheek linings, these are the cheek linings, they develop a reddish Mallory rash that is very painful. So usually toddlers are also seen with this manifestation and this results, right? So usually physicians think that it is a some sort of like a rickettsia infection, or you can say a pediatric dermal infection or manifestation, but a differential diagnosis is must for this condition, right? Apart from that, there is an autoimmune disorder that leads to degeneration of nephrotic cells in the kidneys, and that could lead to nephritis that is induced by lupus. So usually these are seen in the individual or the woman that are aged 45 or above usually, and this happens to be in old age people also. So lupus nephritis is the reason, and the main reason is the anti-nuclear antibodies start attacking the glomerular cells, basement membrane, due to the involvement of IgA antibodies also, right? So in the same way, IgG antibodies or warm or cold antibodies, and they react in the immune environment, and they become like a violent wild type of antigenic response. They produce a wild type of antigenic response in that. So for that purpose, what happens is the symptoms are very much different. Approximately from the WHO report, it seems to be like for a lupus, systemic lupus erythematosus, the quoted symptoms is around like 36 type of symptoms that could include headache, vertigo, and apart from them vomiting, okay, and then you can say colicky pain, and then joint pain, arthritis, septic arthritis, and you can say brain fog also. In some cases there is a Mallory rash all over the body also, okay. So it becomes a rheumatic condition. So how we can know that our particular child or a particular family member is been suffering from this disease, and how a layman can get an insight about this. So basically the condition, the number one condition is the child or the individual or the patient will have a classical symptom of Mallory rash. Apart from having Mallory rash, there will be a usual headache pain. Apart from the headache pain, there will be gastrointestinal disturbance, right? And there will be a realm of depression and anxiety due to that. Apart from that, the person have very febrile uh, nature. They will having febrile, okay, and they will be feeling like uh, you can say they will be soon get a vertigo like condition, or they will be they will be unconscious soon. So due to the low blood pressure also, so blood pressure and hypertensive activities also tends to like decrease and increase according to the condition of the glucocorticoids released in the kidneys. Okay, so usually nephritis also condition in lupus nephritis is the prominent condition. You will see elevated creatinine and apart from them globulin and albumin. Okay, their ratio also will be disturbed. Apart from that, the bone pain and the arthritic condition will be there. Okay, apart from that, their nails and the projection of the nails, okay, they would be slighted out, right? Slighted out means like this, like this, and this, and sometimes it could be congenital heart anomaly associated with that also. So that leads to be clubbing also, and something related to pneumoplastic condition also, pneumoplastic condition also. So usually the chances are that they can also develop anemia also, because the anti-nuclear bondage usually like continuously damage the good red blood cells also and white blood cells also. So usually the immune environment, due to the so much aggressive immune and environment, there is a wild type of antibodies generation. There could be a condition that is known as like thrombocytopenia, okay, pancytopenia, okay. Then they could have altered WBC also, and their bone marrow like aspiration count is also different, right? So the fair chances are that the comorbidity could be like leukemia and anything else also, okay. So usually the lifespan of this patient are fair above 60 years, and they can be managed by the medications, okay. So it is also a very stigmatic disease also, as far as medical science has been and FDA has been concerned. So usually the awareness week of lupus is also concerned, right? Apart from that, the medication usually includes non-steroidal anti-inflammatory drugs like naproxen, or you can have paracetamol also for the fever, or any other groups of NSAIDs. So usually it's a self-healing disease also, right? So you need a proper care and management and conservative treatment for that. So this was all about a normal information, general information about systemic lupus erythematosus. In the next lecture, we will discuss more of the pathology of the systemic lupus erythematosus in detail. For that, keep subscribing my channel, and I'll be making more and more videos on the different medical condition. Thank you. Signing off.